Hello, thanks for joining me today. My name is Dr. Chris Fraser. I'm a consultant gastroenterologist with a particular interest in endoscopic procedures, including the Stretta endoscopic anti-reflux procedure, which I perform at the Weymouth Hospital here in central London. And the reason for this video today is to really talk to one of my patients who had a Stretta procedure about 10 months ago now. She's a retired ex-nursing sister and 70 years old, but looks much younger. I think what she has to say is going to be really helpful here. Angela, thanks for joining me today for this interview.
Thank you, Dr. Fraser.
Would you like just to talk about the symptoms of reflux that you suffered from before we met and how long they affected you for?
Yes, I'd always had total robust good health and never thought at all about what I was eating, when, having a normal diet, and being able to drink a glass of wine or have a whiskey soda, whatever it was you like. And about 5 years ago, I noticed that I was starting to get some symptoms. I think the worst thing, or the first thing I noticed, was a burning sensation in my throat with acid sort of tracking up. And it got to the stage whereby it was always worse in the evenings, and eventually I had to use more pillows so that I physically was in a more upright position. I self-treated in the chemist, supermarket, antacids. I did get through quite a few tubes of these things. And diet itself, I didn't change my diet. I would use these antacids. If I was in a stressful situation, I did experience some discomfort there, abdominally, central abdominally, and these could be relieved by these antacids. Well, this went on for probably a couple of years until I was in a hotel having a meal. It was chicken, and I had this sensation that I couldn't swallow this chicken down, and that alarmed me, and I then decided I better go and see my GP, which I did.
Yeah. What about other symptoms like voice changes or cough,
That came later on.
Okay.
I think I did develop a bit of a cough, which my husband commented on. I actually hadn't realised it. I think I've always had a fairly low voice. It may have got lower, who knows, with age, antiquity and everything else. But it was the pain and occasionally a feeling of nausea.
And bending over or doing sort of things like that, or working in the garden, did that affect
that
things?
would bring it on within an hour of bending over and doing. I have a big garden, which was a pleasure in retirement. That did make it worse.
Right.
So I've had to really curtail some of the gardening down the years.
So in terms of impact on quality of life, what do you think? Was it pretty severe, or mild or moderate?
It was something I lived with because I never actually let anything get on top of me in that way. I'm always going to deal with it the best way. But yes, it was. I always had to make sure I carried around a packet of these antacids. I had to deal with eating before I had a drink, this sort of thing. I found that food made the symptoms easier on occasions.
Right. So you met your GP and he started you on any regular medication, the proton pump inhibitors?
Well, before that, I went to him after I'd had this sensation that I couldn't swallow on this particular occasion, and he sent me along to the local hospital to have an endoscopy to see what showed up on X-ray if there was a problem. And in fact, it showed I had a small hernia from the stomach.
A small hiatus hernia.
A small hiatus hernia. And on the strength of that and the symptoms of the acid coming back up into my esophagus, he put me on to proton pump inhibitors.
And usually they're pretty good, those drugs. What made you think about, other options for your treatment,
I didn't want to stay on medication for the rest of my life, which I hope will be very long, and decided I was going to try not to stay on these proton pump inhibitors or have to suck antacids all my life. And I researched what else was out there.
Was that looking on the internet, or speaking to people, or newspapers?
No, it was a newspaper article I actually read a newspaper article about a patient who'd had this procedure, and thus I arrived at your door.
Got in touch, and
I did.
Yeah. What was kind of attractive about Stretta for you? You know, having read the article and finding out a bit more about it compared to other types of therapy, which include surgery, obviously as an option for some patients with reflux.
Yes. I was never going to go down that surgical route. I did not want any procedure, whether it was keyhole or anything else, that was going to involve cutting and stitching and any of these things. I thought that what I could, or perhaps better you could achieve, might be exactly what I was looking for. And I, to me, thought there was no other way forward than to try that. So that is what I eventually did.
So the endoscopic approach through the mouth and the procedure being about an hour and under general anaesthetic, that was attractive, and the fact that it's also day case, so you could go home afterwards.
Yes, all of that. Of course, I didn't live in London, so I had to plan, and it was going to be a two-stage affair, wasn't it?
Right.
With a tube down the throat, an endoscope in one hospital, and then I went later and had the procedure, done.
Yeah.
It just seemed not intrusive in my life.
And in terms of the preparation for Stretta that you had to, do, and the environment of the day and the recovery afterwards, how did you find all that?
When I came into the hospital to have the actual procedure done, it was very easy, welcoming. I had a room, I went into the room, the anaesthetist came. I actually have a problem whereby I have to be very careful with general anaesthetics because it's an element that is missing in my metabolism. But having explained that to the anaesthetist, I knew, and he knew about that, so that was not a problem, and I had this anaesthetic and I woke up without really much discomfort other than a sore throat.
You didn't have any chest discomfort
None
or
at all.
abdominal discomfort at all?
No, I didn't.
Right.
No.
Oh, good. And in terms of recovery over the next few days following the procedure, how did that go?
I actually stayed overnight in the hospital in London because
you were
I
quite
lived
far
a
away.
distance and was looked after royally, really, and went home the next day. A sore throat for perhaps 2 or 3 days, and then I asked what sort of food can I eat, and was told whatever you feel that you can tolerate. Left host for perhaps a week, but I went then straight back onto a normal diet, and I've never looked back.
And did you stay on your PPIs after the procedure? Because sometimes people do, or did you just stop them?
I stopped them. I didn't ever take another one.
Okay. You really wanted to get off them,
Yes,
didn't you? Yeah.
I did.
And so in terms of how you responded over time and your symptoms getting better, what did you notice? Did it take long, and what kind of changes did you notice first?
I knew that perhaps it would be a while before I totally got into the whole thing, and it was going to give me, I hoped, lasting benefit. It made sense what you had done and how it worked, and I hoped it would. And you had told me that sometimes by doing this procedure, you actually, everything is boosted very much to begin with, and then you have a drop off, and then it has to come into its own, and then it's lasting. But I didn't have a drop off. I had, after that first week, the symptoms had more or less resolved of this acid indigestion.
So the heartburn and the
heartburn,
sore throat and
all of that. It went, and it was as if I'd never had anything. And I've really had to take very little. Occasionally might get a little sort of twinge of indigestion. That might be once every 3 or 4 months, but certainly no more.
Yeah. So how about things like so food now and physical activity, the bed, lying flat and things like that. How about those things?
I don't give them any relevance at all.
You don't need to think about them anymore.
I don't. I've always been an active person, and nothing has changed. I've remained as active and I can lie flat if I want, although I do know I'm used to a couple of pillows, so
Yeah.
I stay on a couple.
Mm-hmm.
And I eat anything that is presented, or I'm going to cook, or would enjoy off a menu.
And you feel happy you're not on medication?
I do,
No.
I do, because I didn't want any chances of one day having changes in my throat in any way, with acid tracking back and causing any difficulties down the years.
And so how about sort of quality of life now? We're 10 months from the procedure. What would you say to anyone kind of looking at this and thinking about having the procedure?
I think knowledge is very important, to know what it is going to do. And from my point of view, having experienced that, it has just been a life-changing experience, and it was without difficulty, without pain. I think perhaps the more difficult element was when I had an initial investigation through yourself, because you gave an endoscopy before the Stretta procedure, and
to check the anatomy.
And I swallowed this little capsule, really, and that was able to give you the readout.
Yeah.
That
the
was
Bravo capsule.
The Bravo capsule.
Yeah.
Now that was a little strange, because I felt it sort of shift a little bit around just for a day or so, and then I was not aware of it. It wasn't particularly uncomfortable.
Yeah.
And much better than I felt, than me having to sit in a hospital bed with having readings of acid levels or anything like that. To me it worked. And it truly did. It has been a very good and positive aspect.
Great. So I mean, Stretta's kind of not for everyone, and you have to pick your patient and you know and so forth. But would you recommend it for others? And do you feel that would be a potentially good choice for others with reflux, as long as they fitted the right criteria and everything?
I think if patients did fit the right criteria and they felt that they could go ahead and do it, it would be wonderful if every hospital could offer it, from my point of view.
Right.
And certainly I was glad that I did opt upon learning that you were there and you were doing it, and it was a positive.
Great. Well, Angela, thanks so much for coming and providing your story, and I think that's going to be really interesting for people who are watching this. So thanks again.
Well, thank you for asking me, Dr. Fraser. Thank you.